Alright guys, today I am doing this video so especially for first year, second year medical students, and I think it's important, especially for students who eventually would want to go into neurosurgery, and for those students who, because they intend to go into neurosurgery, would want to do elective in neuroscience or neuroanatomy, I thought this video is necessary for them. This is our specimen for today. What does this remind you? This tells you how beautiful we look from the inside. And this is very serious. All right, the skull. The specimen I have on my hand is the skull. All right, and it is called the cranium, or you can call it a skull. The skull is divided into two parts. The bones of the skull is divided into two parts. Basically, it is divided into neurocranium and visceral cranium. Neurocranium in the sense that the part of the skull that is directly in contact with the brain is described as the neurocranium. Don't forget, the part of the skull bone that is in direct contact with the brain is described as the neurocranium. So invariably, this part, that's the skull cap, like what I have on my head, is in close contact with the brain. So it forms the roof of the cranial cavity, and this portion here forms the floor upon which the brain sits or rests. So you see, again, that portion is in direct contact with the brain. So all of this portion that is in direct contact with the brain is described as neurocranium. Now the other part that protects the eye, the mucosa of the nasal cavity, and structures within the oral cavity are described as the visceral cranium. So from the word visceral and then cranium, it means that part of the cranial cavity, or that part of the cranium that is responsible for protection of the viscera. Now, the neurocranium, which is one part of the skulls, of the bones of the skull, is further divided into two. It's divided into the calvaria, which is also called the skull cap, and the basic cranium, which is this portion, the base of the skull. Now, the neurocranium is made up of some bones, which we all have to know. Now, these bones are the frontal bone. That's the frontal bone from the anterior. That's the frontal bone from the inner surface. That's the frontal bone. So the whole of this is the frontal bone. Look at it carefully. That's the frontal bone. Okay, this is the frontal bone. Okay, and right there is the ethmoid. That's the ethmoid, because the cribriform plate is there, and the crystal galley, which we'll talk about just now, is there. Okay, and then we have the sphenoid. This butterfly shaped looking structure there is the sphenoid, and posteriorly is the occipital. So let's take it again. The frontal bone, the ethmoid bone, the sphenoid, occipital bones form part of the neurocranium. Further, we have the parietal bone and the temporal bone. All of these bones form your neurocranium. We're going to take that again. The frontal bone, the ethmoid bone, the sphenoid, the occipital, the parietal, and the temporal bones, all because of the close proximity that they have with the brain, close contact that they have with the brain, they are described as neurocranium. The neurocranium is divided into two: the calvaria, which is the skull cap, like what I have on my head, and the basic cranium, which is the base of the skull. Now we go over to visceral cranium. The visceral cranium, like I said, is the part of the bones of the skull that protect important viscera like the eye, the eyeball, the mucosa of the nasal cavity, and of course the oral cavity. It means to have a jaw lock. All right, okay, good. There are 15 irregular bones, 15 irregular bones that make up the visceral cranium. All right, 3 of them are unpaired and 6 of them are paired. The 3 of them that are unpaired are almost in midline. They are the mandible, that's the mandible because it's in the midline, okay? And then we have the vomer and the ethmoidal bone. So it's 3 of them, the vomer and the ethmoidal bone. Now let me make clear what the vomer and the ethmoidal bone are, because sometimes it can be very confusing to medical students. Now when you look at the nasal cavity, you see a bone that runs from the top to the bottom, dividing the nasal cavity into 2 symmetry half or 2 hemi cavity. Now the superior part of the bony septum runs from the roof of the nasal cavity, and as it drops downward, it doesn't reach the floor. It doesn't reach the floor. However, there is another bony septum that runs from the floor of the nasal cavity as if it is driving up. At midline, almost midline, the bony nasal septum that runs from the roof and the bony nasal septum that runs from the floor meet at midline and form the nasal bony septum. That part that runs from the roof is described as the ethmoidal bone, and the one that runs from the floor upward is the vomer. I hope that is clear. I also want to explain that further using this piece of tissue which I have folded. Now this is my vomer running from the floor of the nasal cavity upward, okay? And this is the perpendicular part of your, that's the perpendicular part of your ethmoidal bone that runs from the roof to the, as running from the roof, it meets at some point with the vomer and form this septum, the nasal septum. I hope that is clear. The other 6 paired bones are the maxilla, that's the maxilla, which is the upper jaw, okay? The maxilla, the zygomatic bone, that's the zygomatic bone, okay? And the inferior nasal concha. Now if you look deep into the nasal cavity, you see 2 shelves right there. We have an inferior shelf and a superior shelf. The inferior shelf is called the inferior nasal concha, and the superior shelf there is called a superior nasal concha. The superior nasal concha is part of the ethmoidal bone, whereas the inferior nasal concha is not. So we already have mentioned one, which is the maxilla, and we have the zygomatic bone, the inferior nasal concha, and this bone here, the nasal bone. Those are the nasal bones, all right? The bones that make the bony part of your nose, this portion here, and the lacrimal bone. Those are the lacrimal bone. You can see that That's the right side, and this is the left side. That's the lacrimal bone. You can see the lacrimal duct right there, or the lacrimal lake, where you have the entrance or the position of your lacrimal duct and the lacrimal apparatus right there. Okay, and then finally, when you flip the bone around, you have this bone that forms the roof of the nasal of the oral cavity, which is a palatine bone. So let's take it again. Bones, the 15 irregular bone that forms the visceral cranium are we have the maxilla, okay, which is paired. We have the zygomatic bone, which is paired on both sides. The inferior nasal concha, which is also paired. The nasal bone, which is also paired. The lacrimal bone, which is paired. And the palatine bone that is paired. The unpaired bones are 3. The mandible, which is the lower jaw, the vomer, and the ethmoidal bone. Okay? Now, if we understand that, we also want to quickly look at some important information. One of the most important information here is the way you hold the bone in describing the bone. In some medical exams, like I would ask my student to hold the bone in its anatomical position. The anatomical position of this bone, or the craniometric reference of the bone, is described as the orbitomeatal plane. The orbitomeatal plane can also be described as the Frankfurt horizontal plane. The Frankfurt horizontal plane is the anatomical position in which the bone of the skull is when the individual stands in anatomical position. And that is the position in which a horizontal line that is drawn that passes the superior margin, a horizontal line that is drawn passing through the superior margin, that's the superior margin of your external auditory meatus, or the external acoustic meatus, which is this opening right there through my external ear. The superior margin, a horizontal line that drawn through the superior margin and cuts through the inferior margin of the orbit. So a horizontal line that runs all the way from the superior margin of the external acoustic meatus, passing through the inferior margin of the orbit, is described as the horizontal, is described as the orbitomeatal plane, or the Frankfurt horizontal plane. We also want to look at some craniometric points on the skull. Before we talk about that, we would identify some important sutures of the skull. Now look at some important sutures. This suture here is a coronal suture. All right, that's the coronal suture. This is a sagittal suture. That's a sagittal suture. By the way, the suture is the kind of joint, immovable joint, that holds together the flat bones of the skull. That's the sagittal suture. And posteriorly, you have the lambdoid. That's the lambdoid because it looks like a lambda. Yeah, it looks like a lambda. Okay? Now, let us identify very important craniometric points. And these points are very important to neuroanatomists and neurosurgeons. So they are the Bregma. The Bregma is a point of intersection between the coronal suture and the sagittal suture anteriorly. That's the Bregma. This point here is called the lambda, not the lambdoid. The lambdoid is a suture, and the lambda is the craniometric point. That is the point of intersection between the lambdoid and the sagittal suture posteriorly. Now, by the side of this skull, we have this point here which is at a point of intersection of 4 flat bones. These 4 flat bones are the temporal bone, the sphenoidal bone, the frontal bone, and the parietal bone all meet at this point, forming this H-shaped looking structure here called a Terrier. P-T-E-R-I-O-N. The Terrier is very important because if I open the skull, you would notice that on the floor, you would notice that on the floor, look at that. Okay, that's the Terrier. All right, let me use this portion. That's the Terrier, and this is this portion. You would notice that in the floor of this skull bone, an artery runs right in the floor, right there. That's an artery. This artery is exiting through a foramen called the foramen spinosum that is running on the floor between the dura meninges, the periosteodural mater, and the skull. So a blow at this point, or trauma at this point, can actually lead to epidural hematoma. We'll talk about that much more later on. Okay, so the other craniometric points, we talked about the Terrier. The other craniometric point is the Bregma, which is the highest prominent portion in the anterior aspect of the facial bone, just before you reach the bridge of the nasal septum, just before you reach the bridge of the nasal bone. The Bregma is prominent in male and not prominent in female. The other point is this at the back, which is the external occipital protuberance. It's called the inion. And then we have the asterion, where 3 sutures meet. That's the occipital suture, that's the temporal suture, and that's the parieto-temporal suture. Meet at this point here, called the asterion. It looks like a star, right? So those are important craniometric points on this skull, and I hope you understand that. Now finally, let us look at the base. That's the basic cranium. At the base, we would see that doesn't look so beautiful, does it? Doesn't look nice. However, this is very organized by the one who has organized it. Okay? Now, there are foramina and important landmarks on the base of this cranial cavity. It is divided into 3 fossa. That's the anterior cranial fossa. Okay, the anterior cranial fossa, because it's a little bit indented. That's the anterior cranial fossa, and this portion here is the middle cranial fossa, and that is the posterior cranial fossa. Each of these fossa have something of clinical importance. Now we're going to see these parts here. Now look at this portion here. Okay, this portion here that is on the anterior, look, that's the frontal bone. Just midline in the internal surface of the frontal bone is a sharp margin that runs from the top all the way almost to the bottom. It's called a frontal crest. It feels sharp when you feel it. Okay, it's for the attachment of your falx cerebri. Of course, we know that falx cerebri is double layer of or reflection of dural foldings. We're going to talk about that in the videos to come. Okay, that's the frontal crest. Feel it? It feels a little bit sharp. Okay, on the floor of the frontal crest, you would notice a small opening right there. That's the opening. Okay, that opening is called the Foramen Circu. The Foramen Circu transmits the nasal emissary vein, which is found in only 1% of persons of the population. Now, as we drive our index finger downward, we come in contact with a plate. That's the plate, and it's in the anterior cranial fossa. That plate is described as a cribriform plate. The cribriform plate has perforations on it, and it has a small stone on top of the plate. The stone on top of the plate is called a crystal galley, and the crystal galley helps in the attachment of the falx cerebri. Okay, and we know that the falx cerebri divides or helps in compartmentalizing the cranial cavity. Okay, so that's the crystal galley. The cribriform plate has perforations on it. These perforations are called the cribriform foramina. They transmit the first cranial nerve, cranial nerve number 1. Now, I always do this. I always tell my students to have on the fingertips the cranial nerves. All cranial nerves should be known by all medical students, first year, second year. If you don't know it, stay out of medical school. For example, I do this brain teasing exercise with my medical students. I would ask them, cranial nerve number 2, you should let me know it's the optic nerve. Cranial nerve number 5, that's the trigeminal nerve. Cranial nerve number 10, that's the vagus nerve. Cranial nerve number 12, that's the hypoglossal nerve. They should know it that way, all right? And they should also know the foramina through which this cranial nerve passed through from the cranial cavity to become extracranial. They also have to know that. So those are some of the things we want to look at now. So we are identifying the first cranial nerve to pass from the olfactory bulb of the brain to the nasal mucosa through the cribriform foramina. The cribriform foramina of the cribriform plate. The olfactory axons pass through it. Okay? The olf is, now we go over to this portion here. Okay? Alright, look at that. That's the optic canal. That's the optic canal. The optic canal will transmit, of course, the optic nerve. And of course, the optic nerve is the nerve of the eye that's responsible for visual acuity. All right? So that's the optic canal that transmits the optic nerve. It also transmits the ophthalmic artery. The optic canal transmits two structures. It transmits the optic nerve as well as the ophthalmic artery. Please take note of that. Now, right here in the middle of the whole event that is happening here, that is where the king sits. And the king is the what? Is the pituitary gland, which is the master gland. The king sits right here on this chair, which I describe as the sella toshica. Okay? He sits right there. And he is properly protected by these pillars. The anterior poles and the posterior poles. The anterior poles and the posterior poles protect the skin. All right? Now we go over to the middle cranial fossa. In the middle cranial fossa, we have right there, I'm sure, I don't know if you can see that. Okay, you can see, right? That's it. That's the opening. That's the superior orbital fissure. The superior orbital fissure transmits the following structure. It transmits the olfactory vein, not the olfactory artery. It transmits the olfactory vein, It also transmits the olfactory nerve. The olfactory nerve is one of the divisions of the trigeminal nerve, the sensory part of the trigeminal nerve, the olfactory nerve. It also transmits the oculomotor nerve. It transmits the trochlear nerve, and also transmits the sympathetic fibers. It transmits the sympathetic fibers. All right? So let's take that again. The superior orbital fissure transmits the olfactory vein. It transmits the olfactory nerve, which is cranial nerve, the CNV1 of the trigeminal nerve. It also transmits the oculomotor nerve, which is the nerve that is responsible for movement of the eye. The oculomotor nerve is responsible for innervation of all the muscles, the extraocular muscles of the eye, except the lateral rectus muscle, which is innervated by the abducent nerve, and the superior oblique muscle that is innervated by the trochlear nerve. And also the oculomotor nerve is responsible for dilation of the pupil, because it sends parasympathetic fibers to the ciliary muscle. So I expect my medical student to take note of this important information. The other nerve that passes through the superior orbital fissure is the trochlear nerve, like we mentioned, and the abducent nerve and sympathetic fiber that pass through the superior orbital fissure. All right? Now, inferior to the superior orbital fissure is this opening there. I'm sure you can see this opening. That's the opening there, right? That's the foramen rotundum. The foramen rotundum transmits, remember, the superior orbital fissure transmits the olfactory nerve. The olfactory nerve, sorry, not the olfactory nerve, I beg your pardon, ophthalmic nerve. If I had said olfactory nerve before, it's not olfactory nerve, it's the ophthalmic place, ophthalmic nerve. The ophthalmic nerve is one of the nerve that passes through the superior orbital fissure, and the ophthalmic vein also passes through the superior orbital fissure. All right, the trigeminal nerve has 3 branches of the sensory nerve. So the first one is the ophthalmic nerve, the second is the maxillary nerve, and the third is the mandibular nerve. Now the second of the sensory part of the trigeminal nerve passes through the foramen rotundum. Make no mistake about this. The second division of the sensory part of the trigeminal nerve, which is the maxillary nerve, passes through the foramen rotundum. Okay? And then we have the foramen ovale. That's the foramen ovale. That's the foramen ovale. The foramen ovale transmits 2 structures. It transmits an artery, which is the accessory meningeal artery. The accessory meningeal artery is a branch of the maxillary artery. And of course, we know that the maxillary artery is one of the branches of the 8 branches of the external carotid artery. So it transmits the accessory meningeal artery as well as the mandibular nerve. The mandibular nerve and the accessory meningeal artery passes through the foramen ovale. Now, posterior lateral to the foramen ovale is a